Ever wondered why some people seem to have a tough time recognizing or describing their emotions? This question may seem perplexing, yet it's a reality for roughly 10% of the general population. This phenomena is known as alexithymia, a personality trait often referred to as emotional blindness. Just like the unseen wind, alexithymia exists, shaping the lives of those it touches in ways we cannot immediately perceive. It's a trait that's more prevalent than one might expect, affecting a significant number of individuals. But what's even more surprising is that it occurs at an even higher rate among those with autism spectrum disorder, or ASD. Alexithymia is not a fleeting state of being or a temporary emotional hiccup. It's a constant companion, a trait that manifests as an inability to recognize, identify, and articulate emotions. Imagine a world where feelings are muted, where understanding of one's own emotional landscape is akin to trying to discern shapes in a dense fog. That's the world someone with alexithymia inhabits. It's a trait that can lead to difficulties in personal relationships, struggles with empathy, and challenges in sharing emotional experiences. Yet it remains largely unseen by the public eye, tucked away in the shadows of our collective consciousness. However, it's crucial to understand that alexithymia isn't a choice or a result of a lack of trying. It's a trait that individuals don't ask for, yet must navigate through life with. It's a testament to human resilience and the myriad ways in which our minds operate. So now that we've shed light on this unseen emotional blindness, let's delve deeper into its types. In our journey to understand alexithymia better, we'll explore its origins, its impact on health, and the ways in which it can be recognized and managed. This exploration isn't just an academic exercise, but a step towards empathy and understanding, a bridge to connect us all in the complex tapestry of human experience. Did you know that there are two forms of alexithymia? Let's explore them. Alexithymia, often referred to as emotional blindness, can be split into two distinct types, primary and secondary. Primary alexithymia is the inherent form of this trait. It's not something that suddenly appears in an individual's life. Instead, it's present from early childhood or adolescence. Imagine growing up with a unique way of experiencing emotions, a way that makes it challenging to recognize, identify, or describe what you're feeling. It's like trying to navigate through a dense fog without a compass or a map. That's what primary alexithymia feels like. On the other hand, secondary alexithymia is not something one is born with. It's an acquired form that can develop following a traumatic event or due to brain damage. Imagine living your life as you always have, understanding and expressing your emotions, and then something happens. A traumatic event or an injury changes everything. Suddenly, the emotional landscape that was once familiar to you becomes unrecognizable. You struggle to understand your own feelings and those of others. That's the reality of secondary alexithymia. Each type of alexithymia presents its own unique challenges and complexities. They both involve a struggle to understand and express emotions, but their root causes are different. One is inherent to part of the individual's emotional makeup from the start, while the other is a result of an external event or injury. Yet, regardless of the type, individuals with alexithymia share a common experience: the difficulty in emotional recognition and expression. This shared experience unites them, making it important for us to understand and empathize with their journey. Understanding the types of alexithymia helps us appreciate the complexity of this trait. But what causes it? The exact cause of alexithymia remains a mystery. However, we have some theories. The human mind is complex, and the factors that shape our emotional landscape can be as diverse and intricate as the brain itself. As we delve deeper into the enigma of alexithymia, we find that it's a confluence of several potential causes, both genetic and environmental. Let's start with the genetic component. Research suggests that alexithymia may have a hereditary aspect. It's a bit like inheriting your mother's eyes or your father's laugh. Some people may have a predisposition to alexithymia due to their genetic makeup. This doesn't mean that if a parent has alexithymia, the child will definitely have it too. It's more like a roll of genetic dice, increasing the odds but not guaranteeing the outcome. Now let's talk about cultural and environmental influences. Picture a child growing up in a home where emotions are rarely discussed or even discouraged. This child may learn to suppress their feelings, to bury them deep down, until recognizing and articulating emotions becomes a struggle. This is how environment can play a crucial role in the onset of alexithymia. Culture, too, can have a significant impact. In societies where emotional expression is seen as a sign of weakness or where certain emotions are stigmatized, individuals might find it safer to retreat into the emotional blindness that characterizes alexithymia. However, it's important to remember that these are just theories. The exact cause of alexithymia is still not fully understood. It's likely a combination of these factors and perhaps others we have yet to discover. While the cause is unclear, the implications of alexithymia are evident in various health conditions. So as we continue to unravel this mystery, let's turn our attention to the ways in which alexithymia can impact an individual's health and daily life. Alexithymia casts a long shadow, with its effects reaching far beyond just emotional awareness. This emotional blindness doesn't stop at the inability to identify and express feelings. Instead, it seeps into various aspects of one's health, creating a ripple effect that can leave a person grappling with multiple issues at once. There's a significant association between alexithymia and mental health conditions. Depression, for instance, is often linked with this emotional blindness. A person with alexithymia may not fully understand their emotional state, which can lead to feelings of helplessness and despair. This lack of emotional recognition and expression can foster a breeding ground for depressive symptoms. Anxiety is another condition often seen hand in hand with alexithymia. The inability to identify and express feelings can generate a constant state of unease. This emotional confusion can trigger a heightened state of worry, stress and fear, the key ingredients of anxiety. Moreover, alexithymia is also connected with eating disorders. The emotional blindness often leads to an impaired sense of self, which can result in a distorted body image and unhealthy eating habits. Conditions such as anorexia nervosa and bulimia are common among individuals with alexithymia, as these disorders often stem from a deep-seated emotional turmoil that the person is unable to articulate or understand. It is noteworthy that alexithymia doesn't necessarily cause these conditions. Rather, it creates an environment where such issues are more likely to develop. The emotional blindness that characterizes alexithymia makes it difficult for individuals to navigate their emotional landscape, leaving them vulnerable to these mental health disorders. With these associations, it's clear that recognizing and addressing alexithymia is crucial. The impact of this emotional blindness is far-reaching, affecting not only an individual's emotional health, but also their overall well-being. Understanding alexithymia and its implications is the first step towards fostering emotional awareness and promoting mental health. How do we identify this elusive trait, you may ask? Indeed, alexithymia, with its complex nature and its intricate connection to our emotions, can be a challenging trait to pinpoint. But fear not, there are ways to recognize it. One of the most widely used assessment tools for alexithymia is the Toronto Alexithymia Scale. This tool, developed by researchers, is designed to measure the three main facets of alexithymia: difficulty identifying feelings, difficulty describing feelings to others, and a concrete, externally oriented thinking style. The scale is composed of 20 items, and individuals rate their agreement with each statement on a scale from 1 to 5. The Toronto Alexithymia Scale is not a diagnostic tool. Rather, it is a measure of the severity of alexithymic traits. It's akin to a compass guiding us through the labyrinth of emotions, helping us understand where we may struggle in the realm of emotional awareness. But it's important to remember that recognizing alexithymia is not just about ticking boxes on a scale. It's about understanding oneself, being aware of one's emotional landscape, and acknowledging that it may be different from others. It's about realizing that emotions, even if they are difficult to identify or express, are a crucial part of the human experience. And let's not forget, recognizing alexithymia is also about understanding that it's okay to have these traits. It's not a defect or a failing, but simply a different way of experiencing emotions. It's about offering empathy and understanding both to oneself and to others who may be navigating the world of emotions differently. So we've identified it, but how do we treat it? Treating alexithymia focuses on the heart of the matter, improving emotional awareness. This challenge, while complex, is not insurmountable. Various therapeutic interventions and strategies can help individuals navigate this terrain. One of the most effective methods for treating alexithymia is therapy. Cognitive behavioral therapy, for instance, can assist individuals in recognizing and understanding their emotions. This type of therapy helps create a bridge between feelings and thoughts, making it easier for individuals to identify what they're experiencing emotionally. Additionally, some people may find value in expressive therapies, such as art or music therapy. These alternative techniques provide another language beyond words to express emotions and feelings. This can be particularly beneficial for those who struggle to articulate their feelings verbally. Moving on to the coping strategies, journaling stands as a powerful tool. It's a private space where individuals can express their thoughts and feelings freely without fear of judgment. Over time, this practice can help them become more aware of their emotional patterns and responses. Another significant coping strategy is open communication. This could mean discussing feelings with a trusted friend, family member, or mental health professional. By verbalizing their emotions, individuals with alexithymia can begin to recognize and understand them more clearly. It's important to note that this process takes time and patience, so it's crucial not to rush it. Lastly, joining support groups can also be beneficial. Here, individuals can share their experiences, learn from others facing similar challenges, and gain insights into different coping strategies. Remember, seeking appropriate treatment is vital if alexithymia is interfering with daily life. It's not a journey that one needs to embark on alone. Help is available, and reaching out is the first step towards understanding and managing alexithymia. Now, let's address some common queries about alexithymia. Let's start with the first question. What percentage of the population has alexithymia? Around 10% of the general populace exhibits a significant level of alexithymia, a trait often referred to as emotional blindness. However, it's more common among individuals with autism spectrum disorder, adding an extra layer of complexity to their emotional landscape. Moving on to the next question. Is alexithymia a disorder or a personality trait? Well, alexithymia is a personality trait, not a disorder. It's characterized by an inability to identify and describe emotions, which can make interpersonal connections challenging. Yet it's not officially recognized as a disorder in its own right. The third question is, can alexithymia be developed later in life? Indeed, while primary alexithymia is present from childhood or early adulthood, secondary alexithymia can emerge after a traumatic event or brain damage. This is a testament to how our experiences can profoundly impact our emotional processing. The fourth question we frequently encounter is there a link between alexithymia and other health conditions? Yes, alexithymia is associated with several health conditions. It's often seen in tandem with depression, anxiety, and eating disorders, underlining the deep interconnection between our emotional awareness and overall health. The fifth question posits, how is alexithymia recognized and diagnosed? While there's no official diagnosis for alexithymia, assessment tools like the Toronto Alexithymia Scale can help identify it. These tools focus on a person's ability to recognize, understand, and express their emotions. Finally, what is the treatment for alexithymia? Treatment for alexithymia primarily involves improving emotional awareness. This might encompass therapy, interventions, and coping strategies like journaling or open communication with loved ones. It's crucial to note that everyone's journey with alexithymia is unique, and so the treatment approach should be personalized. To wrap it up, alexithymia, or emotional blindness, can pose significant challenges. Yet with understanding awareness and the right strategies, individuals can learn to navigate their emotions more effectively. Remember, understanding and acknowledging our emotions is a critical step towards healthier living.